Keratitis is a medical condition characterized by inflammation of the cornea, the transparent, dome-shaped surface that covers the front of the eye and plays a critical role in focusing vision. This condition can affect one or both eyes and may range from mild irritation to severe vision-threatening disease if left untreated. Understanding keratitis requires exploring its causes, symptoms, types, risk factors, diagnosis, treatment, and prevention strategies. Causes of keratitis. Keratitis can arise from several factors, including infectious and non-infectious causes. The most common infectious causes are bacterial, viral, fungal, and parasitic. Bacterial keratitis often results from organisms such as Staphylococcus aureus, Streptococcus pneumoniae, or Pseudomonas aeruginosa. This type is frequently associated with contact lens wear, especially if lenses are worn overnight or not cleaned properly. Viral keratitis is commonly caused by the herpes simplex virus, HSV, or varicella zoster virus, VZV, leading to recurrent episodes and potential scarring. Fungal keratitis usually occurs after injury with plant material or in individuals with compromised immune systems, with species like Fusarium or Aspergillus being common culprits. Parasitic keratitis, though rare, is most commonly caused by acanthamoeba, which is associated with contact lens misuse or exposure to contaminated water. Non-infectious keratitis may result from prolonged exposure of the eye due to eyelid disorders, dry eye syndrome, autoimmune diseases, chemical injuries, or ultraviolet, UV, light exposure. Trauma to the eye, such as scratches or foreign bodies, can also initiate keratitis by providing a pathway for pathogens to invade the cornea. Symptoms of keratitis. The clinical manifestations of keratitis vary depending on the cause and severity. Common symptoms include redness of the eye, pain, excessive tearing, blurred vision, sensitivity to light, photophobia, and a sensation of having a foreign body in the eye. In severe cases, discharge, corneal ulceration, and scarring may occur, which can lead to permanent vision impairment if not promptly managed. The presence of a white or gray spot on the cornea may indicate a corneal ulcer, a serious complication of keratitis. Types of keratitis. Bacterial keratitis, rapid onset, often severe, associated with contact lens wear. Viral keratitis, usually caused by HSV, may recur and lead to scarring. Fungal keratitis, slow developing, linked to plant material injuries, difficult to treat. Parasitic keratitis, rare, primarily due to acanthamoeba, extremely painful with poor visual prognosis. Non-infectious keratitis, caused by autoimmune diseases, trauma, or exposure-related factors. Risk factors. Several factors increase the likelihood of developing keratitis. Contact lens use, especially extended wear, is a major risk. Eye injuries, especially those involving plant material or foreign bodies, can predispose individuals to infection. Chronic eye conditions such as dry eyes or eyelid disorders, compromised immunity, recent eye surgery, and prolonged use of corticosteroid eye drops are additional risk factors. Environmental exposure to contaminated water, UV light, or dust can also contribute to the development of keratitis. Diagnosis. Diagnosing keratitis begins with a detailed medical history and eye examination. Ophthalmologists use a slit lamp microscope to examine the cornea closely. Fluorescein dye staining may reveal corneal defects or ulcers. Laboratory tests, including corneal scraping and cultures, help identify the causative organism, particularly in infectious keratitis. Imaging studies may be used in complicated cases to assess the extent of corneal involvement. Treatment. Treatment strategies depend on the underlying cause. Bacterial keratitis is treated with broad-spectrum or targeted antibiotic eye drops. Viral keratitis, particularly HSV-related, is managed with antiviral medications such as acyclovir, sometimes combined with corticosteroids under close supervision to reduce inflammation. Fungal keratitis requires antifungal eye drops, often for several weeks, and occasionally oral antifungals. Parasitic keratitis requires specific antiamoebic therapy. Non-infectious keratitis is managed by addressing the underlying cause, using lubricating eye drops, anti-inflammatory medications, or protective measures to prevent further damage. Severe cases with corneal scarring may require surgical intervention such as a corneal transplant. Prevention. Preventing keratitis involves proper eye hygiene, careful handling and cleaning of contact lenses, avoiding eye trauma, protecting eyes from UV exposure, and prompt treatment of underlying eye conditions. Individuals at higher risk should be educated on the signs of keratitis and seek immediate medical care if symptoms develop. Conclusion. Keratitis is a potentially serious eye condition that can impair vision if left untreated. Its causes are diverse, ranging from infections to autoimmune and environmental factors. Early diagnosis and targeted treatment are crucial in preventing complications such as corneal scarring and vision loss. By understanding the risk factors, practicing good eye hygiene, and seeking timely medical care, the impact of keratitis can be minimized, preserving both eye health and vision.